Hi, welcome back. This COVID 19 pandemic has taken over our lives and how. And as a gastroenterologist and hepatologist, I would like to tell you that no longer COVID 19 is restricted only to the respiratory tract, but there are being case reports and incidents of involvement of the gastrointestine and the liver as a primary manifestation of the Sars Cov2 coronavirus. So, in the gastrointestinal tract, the most common manifestation would be diarrhea, which is usually 4 to 5 episodes per day and watery in nature, abdominal pain, loss of appetite, nausea, and vomiting. In the liver, it could present as a mild jaundice with the raised liver enzymes or transaminitis. Now moving to why this occurs. So as you all know, the ACE2 receptors or the angiotensin converting enzyme receptor is the receptor which the horn of the corona or the crown of the coronavirus uses to infect a cell. So studies and research has shown that not only the respiratory tract but also the gut cells of the stomach, the intestine and even the liver cells express this SARS-CoV-2 ACE receptor, which makes the gut and the liver more susceptible to coronavirus. Now, who are the individuals who have to be on guard in order to prevent the infection of the gut and liver? Would be patients with pre-existing liver cirrhosis due to any cause. It could be hepatitis B, C, or even alcohol-related cirrhosis, and patients with inflammatory bowel disease like ulcerative colitis, Crohn's disease, abdominal tuberculosis, and even certain cases of irritable bowel syndrome. So all these patients are susceptible, and of course every normal person is susceptible too. So although the fecal-oral route of transmission is yet to be established as a primary cause for transmission of the COVID, based on results of fecal samples containing the coronavirus, we can pretty confidently say that the fecal-oral transmission will be in a few course of weeks or months be established as a source of transmission of the COVID. So not only the respiratory tract but even the fecal-oral samples can cause a coronavirus infections. So please be aware. So I would like to conclude by saying that if any one of you or your family members suffer from coronavirus, then please be isolated and take utmost stringent social isolation precautions and disinfection precautions for at least 6 weeks after you get infected with the coronavirus, because studies have shown that up to 6 weeks there is shedding of the virus in the gastric and intestinal secretions and also in the stools. So please maintain good a separate washroom with a good disinfection protocols, and try and sterilize and wash your linen and clothes separately. So stay safe, and I would get back to you with more research on the novel coronavirus in the gut health and liver pretty soon. So do drop your queries and comments.